All right, so this is about chronic low back pain in the workplace. And I'm Carolyn Hampton from Indiana State University, Doctorate of Athletic Training. So let's talk about the disablement model that can be reflected with chronic low back pain. So some things that we would look at for a chronic low back pain patient would be their office setup. So you want to look at how the chair interfaces with the desk in relation to each individual employee. So different employees have different problems, different height, weight, lengths, things like that. So you want to make sure the chair and the desks are set up correctly. Industrial tasks, you can look at small spaces. Are they trying to hammer, turn a wrench, do things like that in confined spaces, as well as lifting 20 to 50-pound bags for 8 to 12-hour shifts. So there's a lot of different things you can look at there. Impairment and disabilities. So can the person fully perform each work task, or do they have an inability? So adaptations to each pathology, like low back pain. So do they need a protective limitation for the specific task that they have been assigned? Or is there another task that they are able to do safely rather than provide a protective limitation? Effects on peers. What does this protective limitation or the impairment or disability that they are having at work in their specific job function, how is this affecting the way others do their job? Is there any effect at all? Is something that needs to be looked at, as well as the effects on the actual patient. Are they enjoying their job? Are they struggling? Do they have impairments? Do they need to be more protected than what they are right now? And can you provide the necessary care for that patient to make sure that they can do their job safely? So the disablement model can help to assess all of the aspects of the pathology that the patient is experiencing. So injury prevention. So I want to look at prevention in the workplace. So how I talked about a prevention strategy in the disablement model can be to fit the chair to the person, different chairs, different desk setup, correct lifting mechanics, proper shift changes to avoid overwork of the task, things like that. Task changes. So do they need a complete adjustment, or is there a better way to achieve the same productivity? So there's also prevention programs that are related to specifically the industrial setting, such as stretching programs to prevent injuries. These can be created especially for the most common injuries in each job task, so they can change between building or job along the production line. There can also be office prevention programs such as dynamic warm-ups, um, tracking computer usage and breaks taken throughout the day, um, motivation, walking, encouragement of moving, lunch workouts, things like that. So clinically, our job is to do everything we can do to keep our patient safe. So when we are unable to fully protect and an injury does occur, we can refer back to the disablement model to ensure we are healing from all different levels and all different perspectives for the patient. Injury risk factors. So we can analyze the risk of the job. Can we identify pathologies that our patient may be put at risk for? And can we figure out how to prevent them? So are they at risk for chronic low back pain due to improper lifting mechanics? So this is a risk factor that we can fix, that we have an effect on. Assess the functionality of each individual to complete the job. So is each person physically capable of doing the task that they are being asked to do? If they are not, what can we do to ensure that they are completing the task safely? So is there a different job that is more suitable to their level of function, or is there a better way for them to do the job for that specific individual that they're still completing the job with common productivity? And identification of individual risks. So each individual is different, and sometimes you would have to identify different risks for each job specific to each individual. This means every individual with a change of job or starting a new job is going to have an assessment of their risk and of their functionality in their new position. So we want to ensure health-related quality of life. So how do all of these concepts tie together? So we want to identify the risk, and we want to then figure out how can we prevent the risk. So when the risk is unavoidable, we want to heal on all levels to ensure that health-related quality of life is restored through the disablement model. So we want our patients to be healthy and happy at work and be able to go home and be healthy and happy at home as well. So we can't just, in this sense, if they have low back pain at work, they're going to have low back pain at home. So we have to make sure that, yes, we're taking care of them at work and we're taking care of them at home to ensure that health-related quality of life.